Recording, that's better. Alrighty, so welcome everybody. My name's Marie and I will be chatting with you next Friday when I come up to Sydney. So we're going to be looking today at auditing principles and the right way to do a good audit, which is not necessarily the QPA way, although mostly the QPA way. So we're going to look at the core principles of auditing, which include demonstrating integrity. And that's really important, that from an audit perspective, not only can we show competence in what we are doing and due professional care, but objectivity and free from undue influence. Those people being audited will always feel like they're in the principal's office, and that's fine. But it's about being able to, when we come up with some areas of non-compliance, we're able to back that up with why we believe that that is so. That it aligns with the strategies, objectives and risks of the organisation. And for you, the practices that you audit are obviously, they're asking for it, so because it's not a compulsory thing, and so this is where they're wanting to reach a high standard and be benchmarked against other organisations. That the audit is appropriately positioned and adequately resourced, that it demonstrates quality and continuous improvement, that it's clear communication. As I said before, people are always nervous, feeling like they're in the principal's office about to get into trouble. Nobody likes to be told that they're not doing things well. So we need to communicate effectively and provide risk-based assurance, be proactive, future-focused. Although audits are by nature retrospective, you're looking at what has occurred, you also do need to be future-focused about what is going to happen and promotes organisational improvement. So one of the most critical elements of auditing is that no blame is allocated for any problems that are identified. The focus is always on auditing the system, not the people. It's not about, Marie, you didn't do, you haven't followed this process. It's about, is the process the right one? Does it meet the requirements? Is it user-friendly? Is it appropriate? Will it get you, if you follow the process, to the level that you are required to be at? And an easy one of looking at is infection control. Is the process, does it meet the standards, and will the risk to the patients at the end be minimalised because we've done an appropriate infection control process? Or was it a bit slapdash and was never going to make the benchmark that was required in the first place? So it's not the people, although the people will all often take it to heart and take it personally. So undertaking an audit, the audit activities follow a pretty standard flowchart, that being initiating the audit. In your case, the practice has initiated the audit because they've asked to be accredited and they're wanting to keep their accreditation up. In the case that I do, it's the audit is usually initiated by the education department or the regulator. Then we conduct the document review. And so I understand that some of you are the admin team who undertake the desktop review prior to the audit taking place. Then there's the on-site audit activity, which, as I understand for you guys, is a doctor or a medico and a non-medico, be it a nurse or a practice manager, who go out on site. You undertake that audit on site, provide the feedback, distribute the audit report, complete the audit, and with recommendations. And then this is where the QPA system more or less stops, is you send that audit report through and a determination of whether the organisation is accredited or not. Generally, in an audit process, the auditee will then have to develop a rectification plan or a management action plan, whatever the terminology in your industry is, within a time frame. So from an education perspective, depending on whether it's a funding audit or a regulation audit, it's 6 to 12 weeks they have to rectify. And then there's a follow-up audit, which most often is an on-site follow-up audit again. Again, that's not the model that QPA works within, but in most other BU financial auditing, compliance auditing, in many other industries, ISO, it's always a follow-up audit is conducted. Sometimes it's a desktop follow-up, but a follow-up audit is always conducted. So let's take a look at the desktop audit. So it is the beginning. It's how you get the impression of the organisation. It's a high-level documentary review on policies and procedures that you've developed. Often, though, certainly in the field that I work in, people have bought a cookie-cutter version of policies and procedures from a, let's loosely term them, consultancy. They have this set, they're sitting on the shelf. The staff may or may not have read them. They certainly don't live and breathe them. And so then they send them off for desktop audit. You read it, it looks kind of okay often, not always, but kind of okay. And then you get on site and find that what's written is not what you see in practice. That's why you have to have the follow-up on-site audit as well. It shows that at least somewhere along the line they thought about having a policy and procedure. But of course, a good organisation puts that into practice. And so it's what you're there for in the on-site audit is making sure that on the ground implementation of all the practices that are listed in the policy and procedures. So the desktop audit gives us that first look to see, do they have them to start with? There are always key ones that I look for when I go out on site, and those key policies I will drill down into and then question the staff when I'm there to make sure that they happen. I'm imagining from your industry that one of those, for example, would be infection control. So what's our infection control processes and policies around it, and then can the staff tell me about them, and can they show me evidence once I'm on site that they do them and follow them? The tool that you use for the desktop audit is actually quite crucial. So it needs to look against the defined benchmarks. It's not just a read and a general storytelling. It needs to go, these are our high risk areas. Are they there? Does the policy and procedure cover to meet the standards? And I know from the group in Melbourne that recently the standards that you guys audit against have just changed. And I can't remember whether it's gone from 3 to 4 or 4 to 5. But that those changes to the standards will change, therefore, the tool and the focus of what that you're looking against, because the standards have been rewritten for a reason. So they'll hopefully highlight the common non-compliance areas, and it provides you with a starting point. If the policy was weak on infection control as the example, then, or there were steps missing, it's then about seeing what they actually do in practice and whether they follow those policies or not. It gives you somewhere to start. This slide is from your actual pre-survey report. So this is what your document review or desktop audit document looks like. It's not a bad form. What it's doing is making you really drill down into the areas that are deemed to be important to focus upon. Whoops. So the policies and procedures is the first place to start. It might be that there are contracts or standards, instructions, permits, specifications, other things that you need to have a look at. In the case of education, we're not just looking at the policies and procedures, but are their enrolment forms meeting the EVETMIS standards, as an example? The enrolment form that you would have filled in for Marco here to be doing this course will go into ask some questions about, the level of English you have at home, etc., etc. Are you Aboriginal, Torres Strait Islander? What language do you speak? What year did you go to finish high school? Those are questions not because Marco is a bit of a sticky beak, but actually they meet the EVETMIS standard report that he needs to report against. And so the policies and procedures need to have made sure. I'd be looking at his enrolment policy to make sure that it states that he is meeting the EVETMIS 8 standards, which are the ones that he needs to work at that came into force on the 1st of January. You also need to look at things such as records, meetings of minutes, audit reports, risk assessments, so that you have a great picture of that organisation before you walk in. I personally try not to look at previous audit reports until I'm on site. I like to walk in with a fresh, clean sheet of paper with the impression that I have from what they've sent me through already, and then once I walk in the door. Looking at the previous audit reports can sometimes colour you, but each to their own on that one. I always do look at them before I write up my report though. Sometimes the organisation will be doing their own sampling program. And so it's important that you have a look at that, or as in the case for me, I get asked to look at 25% of the student files of organisations that I audit. And so it's about whether they do an internal auditing, checking on what they've done, but also then following through on that sample. And other things such as customer surveys, supplier ratings, so supply chain rating. Again, not so much so for medical accreditation here, medical practice accreditation, but certainly if you were in manufacturing, not only do you audit the manufacturing organisation's processes under ISO, you also look at their supply chain and whether they do any auditing along the supply chain to make sure that what they're receiving is of the highest quality that they should be and appropriately meeting all the standards. Then you have a look in your pre-survey review, you have a look at the policy and procedure manual. And so this chart straight out of your report just tells me whether, for example, a home and other visits 1.1.3c is provided. In many other organisation reports from the desktop audit, we not only look at did they send me it, but does it meet the basic standards of what you're expecting. You again go on here and you can say you determine whether from the document review whether the standards were met or partially met or not met at all. In the example that I have snaffled here, both of these were partially met, saying that they could see the procedures in the policy manual, but the surveyors, once they're on site, will need to review the survey at the survey visit. And that's good practice. So that's saying, on paper this looks fine, but can the staff tell us what they're doing? Have they iterated the process and not updated the policies and procedures? Are they following them or even aware that they exist at all? So having it written down, if it's not written down, it didn't happen, but sometimes being written down doesn't mean it does happen. Here's another example of an audit that's not a non-conformist audit template. This is more a tick and flick template where is the word restraint, for example, defined? Is an enabler defined? Is the procedure clear when the restraint cannot be used? Yes, no, and then a comment against it. In your reports, as I understand, you are mainly looking at, you only report on non-conformity, not on yeses. But that's fair because you are trying to get an awful lot into the 6 to 8 hours that you're on site for. So an audit program has the basic flow through of a desktop audit, a site audit, and a follow-up audit. But there's a couple of things that need to happen in all of that. One of those is before we send people out on site, we need to make sure that we've got the right resources to meet the needs of the practice that we're sending them out to in your case. You have a medico and a non-medico go out, and that's based on, that's your standard process. But I would question whether at times you needed to have a third person. And one example might be that you're out to a regional practice where it has a high Indigenous community. If neither your medico or your non-medico have a lot of experience in dealing with Indigenous cultures appropriately, then maybe it's worth having someone there who that's what their focus is, who's able to provide you with that insight of why things are done, maybe not strictly the same way that they're done in Sydney and Melbourne, but they're done that way to be more culturally specific, for example. So are you resourced appropriately for the size of the organisation as well? I gave the example earlier where I was sent to an audit by the Victorian State Education Department last week, and it was meant to be 2 days on site, and I was going to be looking at, about 100 student files, but they wanted me to do 25%, and it turned out that what I actually needed to look at was closer to 400 student files to be the 25%. So therefore, I A, needed to extend my days, B, needed to get some extra help because it just wasn't going to happen. So it's about, were we aware of the resources required for that particular organisation rather than just a cookie cutter approach? who's responsible for what is really important to have planned before we organise the audit program and go out on site. Sometimes it's not as simple as who's rostered on. Implementing the audit program, how are we going to put it in place? When are we going to be out there? Have we included travel, for an example, in there? How much of their practice are we focusing on? Are we doing a general sweep? Are we focusing on just a particular part of their practice? Directing that auditing activities and maintaining the documentation as we go through. Once we've done that and we're set and we arrive on site, we then, of course, have a opening interview, do the audit, and an exit interview. The opening interview's purpose is purely to set those parameters so that the staff know what we're going to, who's who in the zoo, who's going to be looking at what, and what we're going to be focusing on, so that they've got a chance to ask any questions and be settled in the time of the audit. As I said, it will feel like they're in the principal's office, but it's important that they can follow that through. The exit interview is giving your impression. Sometimes my exit interviews are a week or 10 days after I've been on site, because the CEO or the senior people are unavailable often, and I need my senior people involved at the same time, depending on the complexity of the audit that we undertook. But in general, good auditing practice is the exit interview happens on the day that you're there and you undertake it. It's also important then that you get to review the audit program. So not just we write the report and we send it off. As an organisation, all auditors get together and go, how did that go? Did we do a good job at that practice audit? Was there something that occurred that we can do better, or that we need to change our practices? And so that monitoring and reviewing of the audit program is just as important as monitoring and reviewing the auditee as we go forward. With the extent of the audit program, I know for you guys it's pretty standard. The two of you go out for 6 hours on site. But sometimes you need to, as I said, look at the scope, objective and frequency of the audits to be conducted, the type and size of the organisation, the complexity, how many locations are they in? Is the practice just in one building, or are they scattered across a suburb or a town, or even multiple towns? What are the standards and legislation, policies and contractual requirements that are all involved? For you, you're looking after one set of standards. I'm looking at two different sets of standards plus a number of different contracts that come from the state government. And so which ones are involved for this particular organisation? Is there any licensing or certification? For you, that absolutely is. As we said, the results of the previous audits. Were there any language and social issues that might slow us down in regards to this organisation? Were there any concerns raised for you? Most of the audits that you do are because people have put their hand up and said, I want to be audited. For me, most of the audits I do is because someone's put in a complaint, and so the department's sending me out to do the audit. And then significant changes since the last audit. And that could be the practice has changed hands, senior staff have moved on, or the practice has changed focus and now includes other specialties that weren't there before. It's really important that a risk analysis is undertaken of the organisation. Now, QPA's audit template has actually done a basic risk analysis and therefore sets where you focus on based on a standard practice. It may or may not always highlight the things that for the actual practice that you're looking at. But it's one of the things we'll spend more time on when we get together Friday next week is a risk analysis, so that if the cookie cutter form doesn't work, we understand what we're looking at. So we're looking at the type of risk, what kind of impact that risk will have, the probability of the occurrence and the intensity of the impact, and what preventative measures to nullify or reduce that intensity or probability of the risk occurring. It's really important when we look at risk that we think about the probability of occurrence. And an example is the reuse of single-use items. And one would hope that people don't reuse single-use items. But if they did, the probability of a risk of infection contamination and cross-infection is probably likely because it is single-use and not designed to be re-sterilised and therefore can't be sterilised properly, and so they're highly likely of infection occurring. If they were not reusing single-use items and were using it appropriately, it's highly unlikely for cross-contamination to be occurring because it is single-use item, clean, sterile when we begin. That's a really bad example, but that's understanding that when we look at an organisation, we need to think about how they are implementing their own risk assessment. Sometimes you find in small organisations, and if we were to look at small practices that are, you know, husband and wife in a country town, I'm sure is similar to mum and dad running a college. They're so busy working in the business, they're not working on the business and not always taking that bird's eye view and doing a risk analysis. And that's really why the audit's there, to be doing that for them in a way. We will look at more in depth on Friday how to determine the impact intensity, the priority and existing measures of what they've put in to ensure that they are mitigating their risk wherever possible. At times, that can be additional measures. At times, that's a contingency plan for in the case that it happens. And here in Victoria, in the last week, we've had the coroner's report of a young man who had an anaphylactic reaction in hospital from a non-documented appropriately intense set of food allergies, of which unfortunately led to his death on the morning of his discharge and all the implications that happened. So the contingency plans around that mitigation, because that's a pretty catastrophic result. We'll play a little bit more, but if you've never seen one of these charts to help you determine based on likelihood across consequences what level of risk that occurs. And again, we'll play more on Friday, but the example I just gave of the young man who died, that's obviously a severe consequence. It was almost certain if he was given food with whatever he was allergic to that he was going to have an anaphylactic reaction, so you can simply see that that's an extreme outcome. When we get to your report will be following through the risks identified against the standards of where people can slip down. And in your example, you use a non-conformist report where you write what's the problem that you've seen, what the evidence is to substantiate that determination of a non-conformist, the references to the relevant standard or legislation, suggestions for improvement, and then, as I said, the thing that the QPA system doesn't necessarily do is reference to the follow-up and the management action plans. So the deficiency, finding a non-conformance or a deficiency is you as the auditor's role. Allocating the responsibility is actually the client or the auditee's role. Working out the solutions technically is the auditee's role. As auditors, we are not there to tell them how to solve this problem. You can give them point them in the right direction, and for you, mainly that's here's the standards and this is, tells you how to fix it. Allocate the responsibility and the date for implementation of the rectification is the client or the auditee's role. And then verify implementation and effectiveness. That's in your system, you leave that to the client, the auditee, to do that. In most other, if we're looking at ISO auditing, or in my case against the education standards, the auditor comes back and determines you've had 12 weeks. You said that in your rectification or management action plan that you would fix this. So where are you at, and have you done so? And penalties don't normally occur until they've had the chance to do the rectification, whether that's to the right list or not. Oh, that was the end. So just quickly, does anyone have any questions before we finish up? You can type them. Nancy, I can see that you're still there. If anyone has any questions, please just let me know. Yeah. Hopefully that means that it's all good. Let me just type that in case you can't hear me, but hopefully you can. Of course, you can hold on to your questions and ask them in person on Friday when Marco and I come to sunny Sydney, which hopefully will put on its best weather for us. All good. Can we print it out? You will be able to print this. We will be sending you the recording with this so that you can print it out, absolutely. And of course, on Friday, we will give it to you a booklet with all the slides and things, so you'll have all that printout ready to go. Excellent. Well, sorry to have mucked you around a bit earlier today, but hopefully that's helped to give you an insight as to where we're going to start next week. And so I look forward to seeing you all in person next Friday morning, bright and sparkly. Till then, everybody, ciao.